Now, you can simply pause this video and you can try to find where and what is the problem. Now, in this ECG, what we can see, this ECG more of looks like okay or normal, but when you zoom in and when you see, then you can notice that there is no P wave. If you can want to notice, the P wave is not there here. The P wave is not at all there. Here also you cannot very clearly see P wave. Here also the P wave is not there, which should appear before QRS complex. So P wave doesn't appear here. P wave doesn't appear here. P wave doesn't appear here. It means there is no P wave there. So we must know that the pacemaker, the sinoatrial node, it gives the heart rate of 60 to 90. This is the normal pacing ability of the sinus atrial node. That is the reason why we get the 60 to 90 as a normal heart rate. Now, when this pacemaker or sinoatrial anatomical structure fails to originate an impulse, then that time our AV node junction or AV junction, then it has its own rhythm, and then it starts its own rhythm at the heart rate of 40 to 60 per minute. Because it senses that our pacemaker is failed, it is not able to contract. So to sustain the contraction, this AV junction has to start a rhythm. So the inherent rate of the AV junction is 40 to 60 per minute. And when this junction also fails to initiate a rhythm, then at that time ventricles start contracting at their own, and that rate is around 40 per minute, which is seen in complete heart block. So in this scenario, the P wave is not at all there, and QRS complexes are there. Now, it has to be either AV junctional rhythm or ventricular rhythm, because pacemaker wave is not there, P wave is not there. So in this scenario, this AV nodal junctional rhythm is always present in 40 to 60 rate, and the QRS will be very narrow. So if the QRS is narrow, that is less than 100 milliseconds, then it means it is a sharp and narrow QRS complex, and that is all because of AV junctional rhythm. But if it is ventricular, then obviously it will take more time for the conduction of the impulses. So ventricular rhythm will be always with a wide QRS complex of more than 100 milliseconds. So in here we can see that QRS complex is 74 seconds. So it is very narrow. So it suggests the junctional QRS complexes. The next thing is the heart rate. The heart rate is 54 per minute. It also suggests that there is junctional rhythm. Now next thing is, normally the SA node generates impulse. It goes to the AV node junction, and then it goes to ventricles. So we have the leads which are placed over here, which picks the positive P wave. Now this picks positive because the flow is in this direction, that is from SA node to AV node. This is the direction, and this direction, that is the reason why this is picked as a positive wave. But here reverse is happening. AV node is originating or starting an impulse, and this impulse then goes or can go towards the atria. So this is a reverse direction. So you can get a reverse or inverted P wave, and this inverted P wave may be present before QRS or after QRS also. So in this scenario, what we can see, we can very nicely make out the P wave which is present after QRS. So there is a notch in T wave. There is a notch in T wave. Here you can see that this is typically U wave. This much is T wave, and this is P wave actually. this inverted here also. This is T wave, which is positive wave, and this is P wave, which is an inverted. Here also you can see that basically this is QRS complex, this is T, but this is P wave. This is not T wave as you think. This is a T wave and this is P wave. We can find the same thing here. This is a T wave which is positive, and this inverted is P wave. The same is found everywhere. This is P wave and this is T wave. The same can be found everywhere. Somewhere it may be slightly difficult to understand, but it is the same thing. Here also you can see there is a very nice T wave and short P wave. Here you can see a very small notch, and that is P wave. So this is very, here also this is T and this is P. In here, if you can see, there is very well notch. Here it is T wave, and here a small notch is P wave. Here there is small notch P and this is T. So to call it a junctional, there should not be P, a normal P before QRS complex. The heart rate should be 40 to 60. The QRS should be very much narrow, less than 100 milliseconds. And then that time we can call this as junctional rhythm, and this is a junctional rhythm. Thank you.